Hello, and welcome to the Skills Without Borders podcast, where we are dedicated to share skills needed to break career barriers for professionals that's in health, STEM, and public health worldwide. Hi, I'm your host, Dr. Andrea Clark, and I am so excited of the guest that we've brought in today. She continues to share so much knowledge in healthcare, public health. I mean, she's literally worn so many hats. I feel like she has a lot of skills to really share with our community today.
Yes.
Hello, and welcome, Dr. Stella Onuoha-Obilor. Welcome, and thank you for joining the Skills Without Borders podcast. How are you today?
I'm doing pretty good today. Thank you, Dr. Clark, for having me. I believe it's a privilege and honor to get to make it into your space. So thank you for having me.
You're most welcome. And when I say you are a woman that holds so many titles, when I look at your credentials, I see that you've practiced medicine, you're in the public health sector, you've transitioned as an executive vice president for a clinical quality and public health company and organization. I mean, wow, I am really impressed with just not only the wealth of knowledge that you bring to our global audience and our global learners, but could you share a little bit about your background and how did you make the decision to make so many pivots in the realm of health, science, and public health?
Thank you so very much, Dr. Clark. I tell you, whenever that I'm asked this question, I'm passionate about it, and I'll tell you why. I believe that behind every data point in health industry, it's a human story. Whenever that I'm looking at a data point, I have at the back of my mind that this is a human being. It's not just a number. So with that, I'm a physician executive. I also have masters in public health and doctorate in public health. I'm a certified case manager and a certified professional in healthcare quality. And recently, a fellow of American College of Healthcare Executive. And I say that to say this. All of these letters you see behind my name, they are not what that fuels my passion. What that truly fuels my passion is the ability to develop data-driven interventions and programs that improve health outcomes. So at the center of everything I do is to ensure that people live their healthy lives, that people will access healthcare and have remarkable health experience and be their best selves. So that it's just a little bit about my background. And to add to that, many people may not know about that. I love processes. I love to improve processes, remove redundancies, streamline processes to allow my fellow clinicians work on top of their licenses. So with that, I had done some work within the Lean Six Sigma. So I have both green and black belt Lean Six Sigma, and that has been very helpful. I will tell you, it's different to be a good leader. It also requires a different set of skills to be someone who manages projects, processes, and also to be strategic in managing those processes, developing programs. So I am really appreciative that I went in to do more about process improvement. Yeah.
Yeah. And what I really love about that is that you tied your work into your passion, and that has really flourished and
Yeah.
not only, impacted your life and the people immediately in your life, but the
Yeah.
community and the patient care. I really
Yeah.
believe that whenever we tie our work really into what drives your passion, yes, you can get more credentials, you can get, a new salary increase.
Yeah.
But what's really driving your passion? I have about 25 years in this experience of from research to clinical to some executive leadership. But, and it's not easy. It's not always easy being the decision maker and for everyone coming to you and tapping you. But I think what you can fall back into to kind of be that bridge over troubled water is not only your skills, but your passion. So I really love that you're a passion focused leader, and the incredible work that you're doing. But I wanted to tap a little bit more into the skill of your leadership. As you said, it's a diversity of skills. You have to have different skills when you're doing leadership at different levels. So with your extensive background in healthcare leadership, what core leadership qualities do you believe that's essential to building a sustainable and high performing team?
Thank you. That's a very brilliant question. And I would say, as a physician executive with more than 20 years experience when it comes to population health management, clinical quality, HEDIS, NCQ accreditation, health plan risk adjustment, clinical services, case management, disease management, discharge planning, and all of those, right?
Wow.
My career has been about bridging clinical expertise with data-driven strategies, right? And I thrive so well working with team, improving health outcomes, and more importantly, ensuring that we work and partner as a team. In the clinical space, it's never a sprint, it's a marathon. You're never on your own. So working in silos hasn't been efficient, hasn't been productive. You need to work with people. You need to know how to get them along. You need to know how to push even when you're getting resistance from, be it fellow peers, be it senior leaders, be it even team members that you're leading. So throughout my career, I have been fortunate to work with incredibly talented team members. Together, we have faced several challenges. Together, we have also developed interventions that have resulted to improved health outcomes, top tier quality ratings, right? Where the money is for health plan. And again, doing the right thing. That is what that gives me the passion. It's doing the right thing at the right time for the patient to ensure that they receive the right care at the right time, the right place, and at the right amount, right? So that we do not have overutilization or underutilization. And for you to nurture this type of environment or culture, you need a transformational leader. You need a servant leader. You need someone who will not believe so much in title, but believe so much in people. So when you ask me about my leadership style that has helped me to be successful, I would say I have many superpowers. But amongst those, it's my ability to lead with empathy and compassion, knowing fully well that people are people. They are my strongest asset. They are the biggest and the strongest support system that I have. It's not about my title. It's about the people that do the work. And how do I get them to do the work? It's by being that leader who sees the best in everybody, who sees the best in every member of my team, knowing fully well that everyone on my team is a VIP, very important personality. It doesn't matter your title, but it's like a puzzle. If one piece is missing, the puzzle is not complete, the bigger picture is not achieved. So that has been my secret weapon. It's ensuring that everyone on my team is respected, is valued, and that I care for their well-being. You can never have people on a team that are highly engaged, right? If they do not know that their leader cares so much about them, value them, respect their opinions. As far as I'm concerned, no idea it's a bad idea. It's only a bad idea if I don't know about it. So bring it on. I will value your voice. I will respect your opinion. We will brainstorm together and see what works. It's not my idea that is the best idea because I'm the leader. But the best idea is that idea that it's going to give us the desirable outcome. So that has been my style of leadership. And I also believe that compassion without action is empty. So that's why I believe in empathy. That is compassion plus action. How do I put myself in the shoes of the people that I lead? How do I even be more proactive to solve their problems before their problems will become obstacles for them? Whenever that team members know that you are their leader, that is there to be amongst them and not be against them. So that this idea of us versus them that exists in corporate space will be removed. Be part of the team. Do not create the gap by making it look as if the leader is a perfect human being. No, we are all human beings. We make mistakes. We need to be authentic. We need to bring our real self so that people understand that it's okay not to be okay.
And I love that. I hear your passion when you talk. So it's very invigorating to hear you speak about your work. And most of all, not just your work, the people that's at work, right? And I think you coined that analogy, VIP. Did you say very important
VIP, very important
personality?
personality.
I
Yeah.
love that. I absolutely love that. I never
Yeah,
heard
very
it put
important
like that.
person, right? Because sometimes people think, take for instance, and that is who I am that I'm sharing with you. Every email that I have, in as much as I have a lot on my plate, I will prioritize what I have to do in a day. But it doesn't matter if it's my analyst that is sending me an email. I will not push it and say, I will not answer this email. It's coming from an analyst. It's coming from this team member. It's not from CEO. It's not from my CMO. It's not from my EVP. Some people do that. And what you're creating, it's a culture that make people think you think they're not important because of their title. So I do not respect title. I respect human beings.
I love that. Sometimes we can accumulate all these degrees, which is very valuable
Yeah.
because we need the expertise and we need the credentials. But sometimes we can accumulate certain alphabets, as I say,
Yeah.
behind our names, and it creates a barrier where you're not as approachable. People don't feel as comfortable, being open in their communication to
Yeah.
you. And then what we don't realize because of the titles and because of the credentialing that we've accumulated over the years, it can set the precedence for a certain culture. So I love the
Absolutely.
fact that you're very mindful, it sounds like, of the culture. What culture am I really trying to cultivate here as a leader? And how can I nourish my team in a valuable way, in an open way, in a more empathetic way when it comes to their success? Also, of what do they need? How can I solve your problems? And I think that's a really good mindset to have, especially as a leader of your magnitude and when you're still coming from a place of service,
Yeah.
right? And that's the heart of who you are as a practitioner, on so many levels. I'm here to serve at the end of the day.
Exactly.
And I think and how do
Absolutely.
we encourage and ensure open communication? Because I'll tell you this, when I ran my team, I had over 30 hospitals and teams throughout the U.S. that I ran, and I had multiple lab technicians that I would go in, hire, train, and do the operations to set them up in the reference lab setting. And I didn't have a bad thing when it came to our retention rate. And the team at headquarters will always say, how are you retaining your team? And I felt like you in a lot of ways because I'm open with the conversation. I make myself somewhat relatable to them. So when they're halfway out the door, I'm not trying to come and get to know them now. And, and they're like, okay, where are you coming from? So I'm assessing them very early, not just what I hired you for. I even assess, where do you see yourself in the next 5 years? Or,
Absolutely.
and I work around their vision for their self, right? And that's kind of how I served my team of being future focused and allowing them to be future focused. So how do you ensure an open and effective communication within a diverse team, particularly in healthcare systems? Because we know It is a problem with retaining that talent and keeping that talent, especially with our nurses. How do you feel like communication and collaboration is critical? And do you have any skills or strategies that you use to make sure you are inciting an effective communication style in your team?
Yeah, thank you so very much, Dr. Clark. And I'll tell you, you brought up a very important point when it comes to partnership collaboration, especially in a matrix environment. And that is the reason you see sometimes people work in silos, right? And one of the disadvantages of working in silos is that people will reinvent the wheel. And it's not that they are bad people, it's not that they are wasteful, it's because they are doing something they feel that nobody else is doing it. But by the time that you communicate, by the time that you coordinate and partner very well, right, there is that visibility. People will know what is going on. Even if they're not on your team, they know what you're working on and how they can support you. If I need to develop a program, and I know that Dr. Clark, you already have been successful with that program, I don't need to start all over again. All I need to do is to partner with you, know what is the best practices so that I can replicate what you have already established. So when it comes to communication, leaders can never over communicate. You can. What we truly have today is under communication. And especially where you have different steps of leadership, either that information is not coming from upper leadership down to the people, the end users, or maybe information from the end users. It's not even going as up as where it should be. So the problem now becomes some people are not aware of what is happening. And like I always tell my team, when in doubt, assume positive intent. Because when people are not informed, it's very consequential. They will be assuming the worst is happening. And then when that happens, there is a problem. You are not going to really, you will see actively disengaged team members. Because when people do not understand what is expected of them, chances are that they won't hit the targets that you have set for them as the key performance indicators. So part of the responsibilities of a leader is to ensure that your team members are aware of what is expected of them. And it's only through communication that they will know what is expected of them. What are the metrics that you are using to track your progress? And by the way, what is your baseline? Where are you? Because if you don't know where you're starting at, chances are that you will miss your destination. So always communicate, communicate, and communicate. You can never over-communicate. People will rather appreciate that you're telling them one thing in 5 different ways so that they will have better understanding of what is needed of them, what is expected of them. And also try to make what is expected of you as a leader known to your team members. It has to be bi-directional. Oftentimes, you see leaders holding the team members accountable and not even holding themselves accountable. You have to hold yourself accountable first. You need to make your team know that this is what I'll be doing and this is what I expect of you. When that happens, you are building a culture that will value continuous performance improvement. Because continuous performance improvement should not be eventful. It should be a way of life. Because excellence has no limit. Excellence has no cap. If I'm the best today, I will continue to work harder to sustain the best in class that I am, right? So all of these things that I have said right now is still part of engagement. And do you know one of the reasons that I'm very passionate about engagement? I will tell you. I was reading a research that was recently done by Gallup. Gallup is one of the companies that are leaders in improving engagement, right?
Yes.
And I was really surprised when I saw that we spend 81,396 hours of life working. Approximately 82,000 hours of our life, we spend it working. The next thing that we do that we spend closer, that we spend more hours doing is sleeping. So throughout your life, you spend more of your time working and more of your time sleeping. And now the question is this: if we spend so much hours like that working, how is life at work going? And that's why that research again went further to say that low engagement is costing global economy $7.8 trillion annually. $7.8 trillion annually is what low engagement is costing global economy. And what that means is that 11% of global economy, it's wasted when we have low engagement. That's the global GDP we're talking about now, 11% of global GDP. So you can imagine, right? So when we talk about low engagement, people should know that it's a financial issue. It's also closely related to well-being and your performance indicators.
Wow.
So it's a serious, and I will end it this way before you go on with other questions you have for me. Organizations should know that when it comes to engagement, employee engagement, you have two options. Either you invest or you lose. And the only way you have to invest is by increasing the employee engagement, which will also increase their performance. Otherwise, you are losing big time, not only financially, but also the well-being of your team members will be impacted.
Yeah. That is a lot of great wealth of information, and knowing that when you have low engagement, it's not just about the work not getting done and projects and deadlines not getting fulfilled. It's a financial hit to the organization. You know, so it's all interconnected, right? So
Yeah.
I like what you said. Take a more, I like to say, an interdisciplinary approach,
Yeah.
not only with your work, but how does this work tie into another department's work? How does this work essentially tie into the big picture? But how, as you're someone on your team, how would I know the big picture if leadership is not communicating the big picture to me, right?
Absolutely.
So then you know that you're a significant stakeholder in the vision and the mission of moving the objectives when it comes to our organization. So this is great. Engagement is the key.
Yeah.
And like I said, I just remember how I studied generation. So I had a younger team. They all knew with their science degrees, not sure if they're going to medical school yet. So I stuck them in the lab. But I knew with this particular generation, which was Gen Z, you have to keep them engaged or you will lose them.
Yeah.
Just as fast as you hire them, they will be gone. So what I
Yeah.
did is, that's why I started early. These are young individuals, even though this is an entry level position in the lab. I, tapped into their imagination. Where do you foresee yourself? Okay, if you want to go there, I curated programs and project teams, right?
Very
So
good.
now they're not just working in the lab, they're also working, helping us develop some SOPs. I use them in a multifaceted way. So I bring that up to say, you've educated us and you really showed us some really good skills about empathy, communication, the VIP. I love that aspect. Now, we all know there's no perfect world when it comes to curating and leading a team. We are going to have resistance. It's
Yeah.
just the law of nature. So, can you share maybe a significant time where you had resistance with your team, and how would you help leaders navigate any type of resistance when it comes to leading a team forward? What skills can they employ if they do have some resistance, and how can they navigate through that?
Absolutely. That's another great question. Brilliant. Thank you so very much. And I will tell you, whenever that you are working within the healthcare industry, it's sometimes I think it becomes like abnormal becomes the normal. Because you see these things every day, right? People will push back. There is resistance. And again, we understand that change, it's difficult. Change is painful, right? Let's be realistic. Healthcare is dynamic. What is working as I speak with you right now may not even be helpful or functional in the next 1 hour. There are changes coming from the state regulations, from the federal regulations, NCK, CMS, and all the regulatory bodies, right? So it keeps constantly, changes are happening. And that means if you are working within the healthcare industry and you are afraid of change and you push back on change, it looks to me like you're in a wrong space, because you will be obsolete. Think about the generative AI that is happening today. And people were beginning to be worried. Will Gen AI replace human beings? But if we are realistic to ourselves, you may say yes or no. No, because it's not replacing human beings. Yes, because if I'm using Gen AI and Dr. Clark, you're not using it, I will replace you. So we need to let's go with the flow. When new things are happening, let's jump in, put on our hats, learn the new stuff so that we will not be obsolete. So how do I navigate my way in such a space that you get pushed back, you get people who are gonna say no to your opinions? Like I said at the beginning of my intro, I am data driven. You may not agree with my opinion, you may argue with my opinion, but you will not argue with my numbers. When I come to you, number one, I want to communicate the why behind my ask so that you will understand why, how, and what, right? When that happens, I am coming again with data to tell you this is what I'm seeing from data and this is what I want us to do. And one of the things again that make people push back, or whether it's a program or data-driven intervention that you're building, it's whenever that a leader, it's having 100% ownership of that project. People will push against it. People will make that project fail. But what I have used in the past that has been helping me, and also another skill that I use today, is to partner with people and let them understand it's our project. It's not Stella's project. Why we are doing it, when they understand that, if people are not emotionally connected to what they do, chances are that they won't give it their best. So I try, and the magic bullet there is when you get along with people, people get along with you. And then it will be easy for you to communicate the why they should follow you, where you are taking them. Nobody's coming with you if they don't know where you're taking them. It's practically impossible. Tell me what you need from me, why you need that from me, and where that will lead us. Then it becomes easy for people to come with you because they know that you are fighting a good cause, right? You are not just doing it because you need them to. Everything in healthcare is priority. If you are asking someone to do something today for you, I bet you may be down the list of 100 things they have to do in a day. So how do you make them bring your request up to the list? Is by communicating the why behind that ask in such a way that they will understand the purpose and how that ties into the big picture, the mission and vision of the organization where you work. Everything you're doing should have a link to that. Always as a leader, ensure that you are helping your team members to understand why they do what they do. The moment they have better understanding of why they do what they do every day, people will give their best. And when they're connected in such a level that it becomes emotional for them, they will jump high. They will go above and beyond the call of duty.
Yeah. That is fantastic. They're all things that came to me to seek understanding. So it's just putting, and that goes back to the intentionality and effective communication style, where we're not just communicating to-do lists and tasks and responsibility. We're giving them a behind the scenes of why, giving them the big picture, and it makes them feel more inclusive, I would say. Like, oh, I'm part of the team. I'm not just another number here in the department. I am an active stakeholder that's driving this mission forward. Thank you so much for that. I mean, you are an absolute powerhouse. I must say that. I know you've probably heard that multiple times, but you are definitely a powerhouse. I hear the
Thank
passion and
you.
the vision and the intentionality behind your words. Before we wrap up, I work with a lot of emerging professionals as well in upskill, and a lot of them have dreams of becoming senior executives, and especially young women that's tapped me recently, and they want to be a CEO and they want to go back to their home countries and do great things, and most importantly, shift the healthcare system with their executive leadership. So if you could go back to the budding, early days before you stepped into such a senior level, what is a piece of advice would you give emerging executives as they start their career journey in healthcare?
Brilliant question, Clark. Dr. Clark. I would say this. For every emerging leader, all I will advise right now is if you are going to be a leader that people won't forget you, people will remember you because you are that leader. The way you treated them, it's what they're remembering. 10 years, 15 years, 20 years, they will remember you. What you tell people, they will forget. But you see how you make them feel, they will not forget. So I said that to say this. Be a compassionate leader. Be an empathic leader. And more importantly, be that leader that will value your team member. Respect the voices of internal customers, your team members, before even the external customers. Because happy team members will mean happy customers. So I will want these emerging leaders to understand that it's not about title. It's not about you being the VP. That's not what is going to get the work done. What will get the work done will be the strong relationship you will build with your team. Will the team understand that you value and respect them? Will they say that this leader, you got their back? If they know you as a transformational leader, as a servant leader, they will follow you. They will not even ask you, why should I jump? They will ask you, how high do you need me to jump for you? Because they will always make your face look good in the organization. So what I will advise finally, every emerging leader, know that people are people. By the time that you give the best to people, value their well-being. Be that leader that is vulnerable. Be that leader that is empathic. Be that leader that is authentic. Be that leader that knows that it's okay not to be okay. You can't fake it. If you are not okay, you are not okay. We need to find out how we can help you so that you will be okay. What is not okay is that you not being okay all the time. Something is wrong, then we need to know what is the problem to fix the problem, right? So that is the leader that people will follow. That is the leader that everyone wants to come with them, because you are not just sending message. You are the message. Be the message. That's it for me. And if I'm looking up to a leader that is always telling me what to do, that is always sending me the message, and that leader is not the message, him or herself, I don't want to follow you as a leader. Because you're gonna, it's just like children and parents. Like I have 4 of them. Do you know, even when your children will not listen to you, but they will not fail to do what you're doing, they are good imitators. Parents are the best books that their children will read in their entire lives. The same way team members, leaders are the best books that the team members are reading. So walk the talk, and when you talk, you see commitment, follow through on commitment. If you say you will do this, it's better you don't tell your team you will do something and then you don't do it. It's better you don't even commit yourself. By the time you follow through on commitment, team members will always follow you. And finally, let them be leaders that will know that you don't only catch people doing bad things. Catch them doing good stuff. Recognize your team. Appreciate them. Appreciation is the glue that holds every team. Timely feedback. And I believe in that saying that feedback is breakfast for champions. So give timely feedback. And when you're giving that timely feedback, target it. It has to be tailored. Don't generalize it. If Dr. Clark has done something good, don't come and say, thank you, team, for being wonderful. Who is that wonderful person on that team? Call that person out. Catch them doing good stuff, recognize them, praise them, appreciate them. Nobody has ever died of overdose of appreciation. If there's anyone who has died, I need to have that data. But as I speak to you today, I don't have data of any team member who died from overdose of appreciation.
Yeah, I don't recall any previous team members or any team members that I manage and lead now. I always express appreciation. And speaking of appreciation, we here at Skills Without Borders, powered by Upscale, we greatly appreciate our time of talking to you today, Dr. Obilor, and we are forever changed by this message to have a more servitude when you're going into leadership. Yes, you've worked extremely hard throughout the years, the 20 plus years that you've been in the industry. But it's not just about the title. And I love what you said. It's not just about sending the message, become the message. That is powerful. So thank you so much for your time today. Thank you for your skills, your knowledge, and really the impact that you're really making in the industry at large. I really tip my hat off to you. It's been such a pleasure to have this discussion, and I've taken away a few gems myself as I move forward, with the Skills Without Borders brand as well. So thank you for your extraordinary wisdom, authenticity, and your leadership.
Thank you for having me. It's been a great one today. I really have appreciated the time we spent together. Yeah.
Same here. And if you enjoyed this conversation and you want to gain more insight from our global professionals who share invaluable skills to help you break through various career barriers, then please feel free to subscribe and join us on Spotify, Apple Podcasts, and stay inspired and keep soaring higher. Thank you again for joining Skills Without Borders.